When we look at where we've come and where we are today, we've established ourselves as one of the premier organ recovery service providers in the country. So far, we've done over 2,000 comprehensive NRP cases and over 700 surgical recovery cases. One of our operational differentiators is that we have a hub and spoke model, which allows us to keep clinical resources, equipment, and supplies at different locations around the country, so that when a donation opportunity presents, we can mobilize our clinical team, all of the supplies and resources, and these technology and devices from one of our hubs closest to where the donor hospital is presenting. What that does, it allows us to mobilize and pursue rapid donation opportunities better, cheaper, faster. One of the big things we're all trying to do in the transplant space is reduce costs. This is one of the ways that we do this, by offering that true one-call solution, mobilizing our teams, Trinity Logistics, being able to pursue the opportunities and deliver these organs to the transplant centers for implantation for the recipient. When we look at all of our combined service offerings in the organ recovery space, I mentioned that we are one of the only comprehensive NRP service providers in the country, allowing us to mobilize surgical teams and perfusion teams to pursue these opportunities that some host OPOs in other areas of the country don't actually possess. For our OPO partners, we allow them to consider using NRP for every DCD opportunity that presents in their DSA. Some of the top OPOs in this country, they will consider using NRP for every single DCD that comes through the door. For our transplant center partners, we allow transplant centers to keep their internal resources at home, instead sending our specialized teams to go recover these precious organs, allowing their internal teams to stay at home, treat patients within their home facility. We, as a trusted partner, then carry out the organ recovery using the same clinical standard and expertise that they have come to expect from their program. When we look at our traditional organ recovery service line, we have thoracic and abdominal recovery teams that can pursue both brain dead and DCD donation opportunities. One thing that we're really excited about is how we can support these other machine perfusion technologies. Over the next couple years, we're going to see many other technologies and devices come to market, allowing our transplant surgeons on the recipient side to have a prescriptive ideology or plan for every single recipient that comes to the door. For us, while we favor NRP, we are agnostic to the technology. We want to be able to support every one of our partners' needs, whether that be an OPO partner or a transplant center partner. One of the really exciting things for us in Strata is the fact that we can offer a one-call solution. Partnering with our air and ground logistics arm, we can mobilize our teams anywhere in the country, better, cheaper, faster, to pursue opportunities and reduce costs. When we look at the focus and spotlight that exists in the organ procurement space right now, it's very clear that we need operational standards in the procurement space. We at Strata take this very seriously. Through our proprietary software and platform, we utilize electronic documentation, data capture, and have robust policies and procedures so that we ensure that the highest level of quality is upheld for every single organ recovery case.